Hi there, I'm Jordan. I'm one of the physician assistants here at Victory in Motion, home of knee repair, not knee replacement. I have Dr. Petropoli here with me today. Earlier today, we did a procedure on a woman who had rotator cuff surgery 14 years ago. And compared to then, she's actually developed a lot of arthritis since that point. And luckily now for her, we're able to treat her with some minimally invasive regenerative procedures that can help her to hopefully avoid a shoulder replacement one day. But it was interesting, while we were doing the procedure on her, she was telling us about her daughter who we did an ACL reconstruction on when she was 16 years old, and she's 33 now. And so go over a little bit what...
Yeah, I mean, we were just like, our jaws dropped, right? She's like, oh yeah, my daughter's 33 and she just got her knee replaced. And we're like, now, it's not surprising that someone who's had an ACL reconstruction will develop arthritis, right? So someone who tears their ACL, they got about a 50% chance of developing arthritis in that knee within 4 or 5 years, all comers. If we do an ACL reconstruction, they still have a 50% chance of developing arthritis, but it maybe pushes it out 12 to 14 or 15 years. So add on 15 to 16, and that's 31 years old. She's 33, she got a knee replacement. That's nuts. So number one, 50 to 75% of ACL tears are preventable, and that's one thing that people don't talk about. There's preventive programs, Sportsmetrics. Dr. Noyes at Cincinnati Sports Medicine came up with that program. We've used that program and had amazing results. Like, that doesn't get talked about enough. And if we want to end the need for knee replacement by the year 2043, then we need to prevent these things, right? Now, the other thing is, once they tear it, an ACL reconstruction does a great job for stability, but it doesn't prevent the arthritis. So what have we been doing lately for that?
Well, we have our bear procedure where we can actually regrow somebody's ACL, which the studies have shown that significantly reduces the secondary arthritis that develops after an ACL reconstruction.
Right, now the only thing I'll say there is it's tending to look like that. And in pigs, it definitely showed that in the pig studies. In humans, it's trending that way, but that is unpublished data. We don't really know that 100%, but we are hoping that the pig data translates into humans, and early results, or at least what we're seeing too, it seems to be that way, but we're waiting for the final results. But the idea would be to take this implant, it looks huge, right? Well, the ACL, if it tears, we soak this in the patient's own blood, we sew it in between the two torn ends, it kind of smushes up in there, and then this functions as a bridge for the two torn ends of the ACL to grow back across over the course of 8 weeks. And now you still have your own ACL. And in the pigs, at least, the pigs who had their ACL repaired with the bear did not develop arthritis, whereas the pigs who had their ACL cut and just ran wild developed arthritis. The pigs who had their ACL cut and had an ACL reconstruction developed arthritis. So we're hoping that that translates in, but that is just a crazy perfect example. 16 years old, she gets her ACL reconstructed, does actually great, no instability, but develops severe arthritis, and now she has a knee replacement at 33, which is nuts. By the way, I wish she had come to us. Yeah. We probably could have at least helped her put that off for longer. We have a lot of people who have even bone-on-bone arthritis. Are we gonna make it look like they were 18? No, but we can definitely help lessen their pain, improve their function, help them achieve their goals. And I think that's a big thing. And at 33, she's gonna need another knee replacement and probably even another one. And each one is more and more difficult, more and more risky. It's crazy. So great example, and thanks, that's a good example.